Hey, welcome back to the channel. This is Dr. David Song at Rehab Hero, and today we're going to be talking about part 2 of the squat warm-up series, spinal stability and motor control. So when it comes to doing a warm-up, of course, not everyone will need to do these exercises. These exercises will be particularly for those who have low core endurance and those who tend to kind of shift or rotate during their squat because the core is not holding their body up strongly. The core is going to be the limiting factor in a squat. This is kind of why you could put a lot of weight on something like a leg press machine and push a lot of weight versus the squat. It's because in the leg press machine, you're supported, your back is supported, your core is supported, and you're able to just push as much weight because your legs are freed up to move. Now in a squat, on the other hand, if you let go of your core, you're going to pretty much collapse. You're not going to be able to hold up the weight, and it might result in injury. So it's really important to work on spinal stability, especially those who are aspired to be bigger lifters. Today we're going to go over one of my favorite exercises to stimulate the core, the Pallof press, but we want to combine that in a squat movement. So all you're going to need is a strength band and something sturdy that you could tie it down to. If you have a squat rack at home, that works perfectly fine, or if you have a door band set, that works as well. So for this exercise, I like to hold the band roughly at the level of my lower chest, where it comes your abdomen. And from here, you're going to take a step to the side until there's tension on the band. Now, there's a few different versions of doing the squat Pallof press, and I actually recommend doing both, or all of them, if you have the time. But you don't want to go to the point of failure because you're going to pre-fatigue your core too much, and then it won't be there to help you during your squat. So you want to just kind of get your core engaged. You're not trying to fatigue it. So for the bodybuilders out there, you're not going to go into failure or rep out until you can't do any more reps. So from here, you're going to pull it down right to your stomach, and then you're going to go into your deep squat position. From here, you're going to push your hand out. And what you're trying to do is make sure that your shoulders are stacked over your hips, okay? So you don't want to be rotating or shifting towards the band. You also don't want to be overcompensating and trying to shift over or rotate the other way. You want to just hold that center position, and then you stand back up, pull it back in, and you're going to transition into this motion, okay? So this is the full squat Pallof press warm-up. And so the next version that we're going to talk about is kind of going into a Pallof press into it while you're in a half squat, and then you're going to walk to the side, back and forth while you're in that half squat position. This is more of a dynamic stabilization drill. So you're going to take that band, okay, you're going to pull it out straight out in front of that kind of abdominal region. You're going to go into a half squat, and you're going to just take a step to the side, stabilize, take a step back in, stabilize, and you're just going to be repeating this for a few repetitions here. Now, generally speaking, I like to do about anywhere between 5 to 10 repetitions. It really depends how long it takes for you to kind of start to feel your core engage and during your squat. So the next exercise we're going to go over is both for spinal stabilization and for motor control. So some of you out there who are heavy squatters, I know you guys have some tight hip flexors or you feel some hip impingement while you're doing that squat. This exercise is for you. So what we're going to do is you just need a strength band. This is a heavy one, about 80-pound or 100-pound strength band. And you need a pull-up bar that's pretty stable, okay? So the door waist pull-up bars are not going to work. You want something that's actually attached permanently to an object, and you're just going to loop it up there. Okay, so I'm just going to move this a little forward. From here, you're going to kind of loop the band through both your wrists here. Okay, you're going to grab onto that band nice and strong. You're going to keep your hands kind of above your head, and you're going to pull the band down into a deep squat. And what this does is it's actually getting you to use those hip flexors to actually pull you down to hip flexion, right? So when you're standing, hip flexion is here, but when your feet are planted, hip flexion is at the bottom of the squat. And what we're trying to do is get those hip flexors to dynamically pull you down while your core is being used to stabilize the spine. So look like this, and you're going to go for about 20 to 30 second holds. So I'm going to pull down, getting to my deep squat, and you're going to feel that. Now, some things you want to avoid while you're doing this exercise is just sitting there with gravity. So this is just me sitting there with gravity. You want to actually be actively trying to go as low as you can. Some other things that some people may be doing is hyperextension of the spine. That would typically happen if the hands are too far overhead and they don't have the shoulder mobility to hold them there. So like some things will be like hyperextending to try to get underneath it. Okay, you just want to be sitting in neutral, pulling that band down. Okay, now when you're doing that, you want to brace with your core. Okay, so that's your core is a 360 muscle belt that goes from your one side of your spine all the way around to the other side. It's composed of not just your rectus abdominis and obliques, but you have your transverse abdominis as well as all of your lower back muscles that are going to be engaging as well. So you should be breathing through your belly and bracing through the whole entire, abdominal column, so to speak. So you're trying to brace outwards in all directions as you do this exercise, pulling down, brace. And as you can tell from my strained voice, I am putting max effort into holding this position and then coming back up. All right, so the last exercise we'll be going over is a motor patterning exercise. So for this last exercise that we're going to do, that is to develop motor control of the squat, we're going to use a kettlebell. And this exercise is for those of you who have a tough time kind of doing a squat with a relatively upright position. This is mostly for those people who tend to hinge over right at the hips and even do a little bit of butt winking before they come back up. And I'm not talking about people who do low bar squatting. Okay, low bar squatting is a different type of squat that does require you to hinge over a little bit more. I'm talking about for any other person who wants to do a regular squat but finds it very difficult for them to hold their body upright. Now, sometimes this movement is restricted because of the lack of mobility, but sometimes it is just a motor control issue, which means it's a skill that you just haven't practiced correctly enough times for it to feel like a normal movement. So for those of you who have a motor control issue, what we're going to do is we're going to take that kettlebell and we place it in front of us like that. From here, you want to keep your spine nice and neutral, and you're going to have a light bend in your knees, and you're just going to hinge forward until you can grab the kettlebell's handle. And you want to use a kettlebell that's heavy enough that it won't shift when you pull on it, because what you're going to do at this point is you're going to use it to kind of help you sit down into your squat. So a few things you should notice while I'm in this position. One is that my knees pass my toes, and that's completely fine to do. A lot of people think you shouldn't pass your toes with your knees, but that is completely false and outdated information. The other thing you should notice is that my torso is in a relatively same angle as my shin. And so for those of you who tend to just bend forward, that angle of my shin and low back do not match. However, when you go into that deep squat you want to go until your body kind of matches the angle of your shin. From here, you're just going to stand back up. So we're just trying to reinforce that movement behavior of using your knees and getting your torso angle to be the same as your shins. Okay? And you usually do enough repetitions until basically you can kind of squat down at that angle without any issue. Now, so for some of you, it might take a little bit more than just one session of this or one set of this to get used to, especially if you're so used to that old pattern of hinging over. If that's really ingrained into your neurological system, it might take a little bit longer for you to detrain that out of you, but in the most part, most people can figure it out after 1 or 2 weeks of practice. Okay, so if you guys enjoyed this video, please give this video a like and subscribe to my channel. If you have any questions about this video or any questions about some videos you want to see, please let me know in the comments below. I'll see you guys next time.